7:14, new this morning with football season in full swing. Oklahoma State University sports medicine programs working to tackle one of the biggest topics in sports safety today, concussions. Joining us live in the studio is Dr. Nick Thompson with OSU Family and Sports Medicine. Thank you so much for being here. What are the most common causes of concussions?
Yeah, so really, a concussion is we classify it as a mild traumatic brain injury. So we're looking for a few things. Usually there's going to be some kind of impact or injury, and then we're looking for symptoms after that. So really you need that impact followed with the symptoms from the athlete or the player.
A lot of people associate a concussion with football, but it can happen in other sports too.
Yeah, we see it in any sports. I mean, the most common are going to be your contact sports, so football, soccer, ice hockey. Those are the ones where we see more collision, so therefore more potential injury mechanisms, but you can see it across any sports.
How serious can it be?
It varies. I mean, most concussions, in the adolescent population, they're going to resolve within 4 weeks. So, I mean, and many kids recover much quicker than that. So it just requires, proper evaluation and treatment, and then, trying to educate them on subsequent concussions and further injuries. So, but most kids recover well as long as they're getting proper treatment.
If you've had one concussion, are you more prone to suffer another?
Yeah, so the studies would show, what we call the threshold of the injury or that trauma lowers with subsequent concussions. So you're going to be at a little more increased risk of secondary injuries if you've had a previous concussion.
And I know just in what we've reported, there's been heightened awareness. Coaches and officials, administrators, everyone's, kind of watching. Everybody's got eyes on the field or on the court. And if a player goes down and appears to have hit their head, there are protocols that they follow.
Yeah, and I think that's been great, over the past few years. We've got a lot more education out in the public. And so, people that are out there watching games or parents, they have a heightened awareness. So it really helps get these athletes into our clinics so we can evaluate them and get them back to sport quick and safely.
And that's something that you guys are experts at.
Yeah.
So once they bring them in, you guys can evaluate and determine just how serious it is.
Correct. So we'll bring them in. Like I said, we do a pretty thorough examination. There's a cognitive piece where we're checking their memory. We do a thorough physical examination, making sure there's no other injuries. Some of them may require some therapies, different modalities for treatment, but then once we can get them back at baseline or symptom resolution, we can then safely, return them to play.
And a lot of these, I know high school athletes have like a baseline test that they take before their, as part of their pre-sports physical, so like a sway test, or so they can kind of measure it against and evaluate to determine.
Yeah, and it helps because a lot of the symptoms with concussions are symptoms you would have on a daily basis. So, I mean, people have headaches, they're nauseous, they're dizzy, and so if we can get some kind of baseline for each individual, that helps us, it's a piece of the picture, so we can kind of utilize all that information, see that they're close to their baseline status, and then attempt to return to play protocol.
Yeah. Well, I mean, sports are a big part of many families' lives. Good for kids to be active, good for kids to be part of a team, so it's good to keep them healthy and on the field playing.
Yeah, and that's what we're here for, is just to monitor them, get them back as quick and safe as we can. So back to the sports they love.
Yeah, it's a fun time of year. Thank you so much for being with us this morning. We appreciate it.